Being a nurse practitioner student and a newly graduated nurse practitioner is hard. You don't know patients very well. Every visit you have to prepare really well. Otherwise, you might embarrass yourself that you don't know what's going on with the patients. You might miss some critical information that you're supposed to know as a clinician. It's very important to prepare before you go into an exam room to see a patient. In this episode, I'm going to talk about 5 things you should do before you go see your patient as a nurse practitioner. Hi, we're going to get into today's topic in a minute. But before we're going to dive into today's topic, I just want to mention that we are giving out free access to our online workshop. This workshop is about confidence. We had this workshop and we got so many good responses, feedbacks from the audience. So I wanted to give it out to more people so that you can boost your confidence and get more career opportunity, get into your dream nurse practitioner programs, and get pay raises. How you can sign up and how you can get access to this workshop is go to a website, usa.jnpproject.com/confidence. Again, usa.jnpproject.com/confidence, and sign up for our free email list. This is a 90-minute online workshop. You can watch it as many times as you want. It also comes with a handout of the slides that I used in the workshop. Again, a lot of people loved it. It really helps to boost your confidence. So I want you to have the opportunity. So please sign up. All right, let's get into today's episode. Being a nurse practitioner student and being a newly graduated nurse practitioner is hard. Most of the patients, if not all patients that you're going to see are new to you. So you have to get to know the patient quickly. Whether you are a nurse practitioner student or a newly graduated nurse practitioner, you should take time to prepare before you go into exam room to see your patient. Good preparation makes a huge difference in your efficiency, trust relationship with your patient, and confidence in your performance. But you also have to be good at time management. You don't have forever to prepare for each patient because patients are lining up to be seen by you. In this episode, I'm going to teach you 5 things you must check before you go into exam room to see a patient so that you can gain trust from your patient, you can perform well, and feel confident in front of your patient. Let's dive in. So first thing I usually do is check to see if the patient is new to me. As a nurse practitioner student, most likely majority of patients are new to you, but who knows? There might be a time if you're doing clinical at the same place for months and months, there might be a time that you see the same patient multiple times. And why this is important is because I want to build a good relationship with my patient, and having good relationship is very important. First of all, they trust you, they feel familiar, and they feel more relaxed to talk about their concerns, ask questions, and also they might trust us more if they know that we care about them. How to show that is one way is to remembering them. Patients know that we see multiple patients every day, but as human to human, they appreciate that if we remember them as one human being. I usually scroll and make sure that if I've ever seen this patient or I've never seen this patient before, so I usually scroll down and make sure. If I see this patient years ago, but I haven't seen them for a while, but if I know that I haven't, it was like, 4 years ago, 5 years ago, then I usually tell patients like, oh my God, long time no see. And a lot of times patients really appreciate that you remember them. Technically, I might not remember. I need some trigger to remember. And once I know I'm looking at the previous note, that brings me back memories and I tend to remember a little bit more. But I just want to show them that, hi, welcome back. I remember you. Or just I want them to feel welcome and don't feel, feel like they are a stranger. That's one way for me to use is try to look and see if I ever met them before. It's awkward if you actually met them before and then you say, hi, nice to meet you. And then your patient tell you, we actually met. And then it will be like, whoops, sorry, I forgot. Then your patient might think, I know I'm 1 in thousands, so she probably don't remember, but it's really not good impression. So usually I try to just quickly scroll over and then see if I ever seen this patient before. Second thing I recommend to do is skim through the last visit. So if you are a nurse practitioner student, let's say you're a nurse practitioner student and I'm your preceptor and you're seeing patients on my panel, and then you go into the exam room and take a history. So before you go in, I would recommend to look up a progress note by me, the last progress note by me, and see what I discussed at the time. Maybe I'm following up with certain thing. Maybe we're talking about last visit. We talked about trying birth control pill to regulate her period, or the patient decided to try new birth control methods, or she has headache and she decided to try new medicine. And so if you have those information, when you go into exam room and see a patient, you can ask, so I know that last time you talked to Miki about trying new birth control methods. Are you still interested in this method? Or did you have a chance to try new birth control brand? How did it work for you? Or you can say, I know you started birth control pill to regulate your period. Did you have a chance to try it? Is it working for you? Is your period regular now, or it didn't work at all? So it's very important to have a little bit of knowledge before you step in. It gives a totally different impression than you just going without any preparation and say, hi, I'm a nurse practitioner student. So what's wrong with you today? What's going on with you today? And patient feel like, oh, so I have to explain from scratch. Versus if you have a little bit of preparation, then patient know that you spent time, you made effort to get to know that patient before you actually step into the exam room. So that gives a totally different impression, and patient prefer clinicians or nurse practitioner student who prepare and who are more willing to get to know them and will prepare for the visit. I usually recommend, even myself, I still do it before I go see a patient. I quickly check my last note and then see what I discussed the last time. So we can follow up and see if I give any new medicines, if it works, or what kind of things we're following up, and what points we should discuss during this visit. Third thing I would recommend to check is check current medication. It's very important if you're going to prescribe something, you want to make sure that it's not contraindicated with other medication. There's no drug-to-drug interaction. So you want to make sure that what medicine the patient is currently on. And you should probably, when you go into the exam room and talk to the patient, you want to just double check they are actually on those medicines. Because unfortunately, a lot of times, a lot of clinicians don't clean up the medication list, and the medication that was prescribed years ago might still be in the list. You need to make sure that what medication that patients are currently on right now, so that you can think about, okay, this patient is on this medicine right now, so I should avoid prescribing this. And sometimes also checking a medication gives you a little bit of hint. Like if a patient is on sumatriptan, then you can say, so you are taking sumatriptan, do you have a migraine? Because you can guess what kind of disease or conditions that they have, even if the past medical history is not up to date. You can guess, so you're taking this hypertension medication, so you have hypertension. So that also gives you a very important clue of what kind of health state the patient is in right now. Fourth thing is check past medical history. When you're trying to diagnose disease conditions, this is very important. You need to know what kind of disease they have so you can get more information about what kind of disease or conditions are more likely. So for example, if a patient has diabetes and maybe the patient is on certain medication that tend to cause yeast infection, if you don't have that knowledge versus if you have that knowledge, it's easier to connect two dots. You hear the symptoms, you do the physical exam, you find some clinical findings. And if you have that information, it's easier to click like, oh, that's probably because of that medicine. But if you didn't know what's going on with the patient as a baseline, that might not be helpful. Definitely recommend to check on the past medical history as well. Last thing you should check before you're going to go into exam room is checking to see if patients are up to date on screening and vaccines. So for example, I usually do women's health. I check for like pap smear or HPV testing or mammogram, depends on the age, or STD testing, chlamydia, gonorrhea screening. I just make sure that those are up to date because I might keep seeing patients over and over, but I might miss. It's embarrassing if I missed. Oh, she's 43. I've been seeing her for 3 years. I saw her multiple times, but she never ever got mammogram. Oh my God. And what if she has breast cancer? Then I might missed opportunity to diagnose that when it was an earlier stage. You definitely want to make sure that your patients are up to date for screening testing, and if not, then you can order the test. Also, vaccine, the same thing. You want to make sure the patients are up to date on the vaccine. So in this episode, I talked about 5 things you should check. First, you should check to see if you've ever seen this patient before, especially as a newly graduated nurse practitioner. You want to build a patient panel. You want to have patients who will keep coming back to you. And to build trust relationship, this is one of the things that you should do, that you don't want to keep saying, hi, nice to meet you, hi, nice to meet you to the same patient, and they feel like she never remembered me. Versus if you were like, oh, hi, welcome back, or hi, how's it going? Good to see you again. You give totally different impressions. So definitely that's something you should do. Second thing is check your last visit note. It could, if you're a nurse practitioner student, it could be your preceptor's last note, or if you're newly graduate nurse practitioner, this is the second time to see this patient, check your last note and see what you discussed at the time, and then you can check to see if there's any progress or worsening of symptoms. Third thing is checking the medication and see what kind of medication the patients are on. And then also check past medical history to see, just understanding the basics of a patient's conditions. What kind of chronic disease do they have? And lastly, you should check to see if they are up to date for screening and vaccines. I hope this video was helpful for you. Give me a thumbs up if you like this video, and also I would love to hear from you. If you can comment your feedback or questions or any requests for future episode, that will be very helpful. All right, I'll see you in the next episode. Aloha.